Dear friends, today we'll talk about the RFA for the trigeminal. So, patient in supine position, neck extension, and you take a AP view. When AP view, you'll see that there is nasal bone, orbits, and you'll see the mandible, and this is a maxilla. So, here what has happened is, due to neck extension, you can see and go on doing the caudal tilt till the submental view is obtained. What is submental view is? The mandible should be W shaped. So the first target is to obtain a submental view. After that, you are supposed to go for the ipsilateral tilt. In this image, what has happened is, even when we take a neck extended patient, the first shoot we can see everything, but after submental view is obtained, you go for the ipsilateral oblique. Once you go for ipsilateral oblique, identify various structures. Do not focus on foramen ovale at this point. Okay, so various structures are mandible, maxilla, orbit, nasal bone. So now try and locate a space between the mandible and maxilla. So the first your target should be to locate a space between the mandible and maxilla. Once this space is nicely seen, then try and look for foramen ovale. If this space is not seen, do not look for foramen ovale. Now once this space is seen, go on doing the oblique tilt, and now you will see that a very nice ovale shaped structure exactly below my pointer. You can see exactly a foramen ovale over here. See, now this is a foramen ovale, and once you locate a foramen ovale, so superomedial is ophthalmic, inferolateral is mandibular, in the middle it is maxillary. Then you go on, mark it, give a good amount of local, and try and insert a needle. So whenever you are inserting a needle, now here we are going for V3 division, try and hit the adjacent bone. Directly do not go into the foramen ovale, try and hit the bone. So once you are inside enough, then once you hit the bone, slide over the bone and take an oblique view. When you taking oblique view, the very first important thing is it should be a true lateral. So what is true lateral? Where you should be seeing true lateral? See, the mandibular borders should be coinciding with each other. External auditory meatus should coincide with each other, and the pituitary fossa should be seen. So this is not a true lateral. So try and do the true lateral. A good true lateral you can see, and you can see this pituitary fossa. Our needle is nearly entering into the foramen, and then we will go inside. So at this point of time, one thing is important. There is a very high chance that patient will have a bradyarrhythmias. So always watch for the bradyarrhythmias. Once you are inside, since the needle is going inside, so once you are inside, this is pituitary fossa, you are quietly, nicely, this is the area of Meckel's cave. So somewhere here will be a mandibular, somewhere little superiorly, and middle will be maxillary, and little more superiorly and inside will be a ophthalmic division. So once you go over here, you go for the motor and sensory stimulation, and once you are done with the stimulation, see for the sensory motor, there should be a difference of at least twice between the sensory stimulation and motor stimulation, and then you go on doing the ablation. Now we'll see I'm position AP, then go for the caudal tilt till you see the submental view, and then you go for the AP, then caudal tilt till you see the submental view, and then go for the ipsilateral oblique. Go on doing ipsilateral oblique till you see the space between the mandible and maxilla, and once you see that, look for the foramen ovale and try going 5-degree cranial and ipsilateral oblique slowly by the image. How does the image occurs? Thank you, friends.